Every time you take your Tamsulosin, something happens in your body that no doctor has ever explained to you. It's not the effect you're familiar with. It's not the relaxation nor the prostate muscle that justifies the prescription. It's not the improvement in your flow that you notice from the first few weeks. It's something that happens simultaneously, in parallel, in a completely different body system than the urinary system, something that the package insert mentions in 2 lines as a possible side effect, and that in reality is a complex physiological response that involves the heart, blood vessels, brain, and nervous system in a coordinated manner every time the capsule dissolves in your intestine, be it the intestine. That something has consequences that accumulate, that are modified depending on what you ate that morning, the ambient temperature, the other medications you have in your body, and the exact time you took the capsule. Consequences that in some men are completely imperceptible and in others produce symptoms that they have been attributing for months to age, stress, or causes that no doctor has been able to identify because no doctor has connected those symptoms with the prostate medication. Today, we are going to show you exactly what happens in your body every time you take Tamsulosin. From the moment the capsule reaches your stomach to the peak hours of concentration with the complete physiology, with the clinical cases that illustrate each phase and with practical information that will change how you understand your treatment and how you manage it starting tomorrow. I am Dr. Isabel Martinez, a urologist with more than 10 years treating patients with prostatic hyperplasia in Spain, Mexico, Argentina, and all of Latin America. And if you are new to this channel, welcome. Every week, I publish information that your doctor does not always have time to give you in the 8 minutes of a standard consultation. Information based on scientific evidence explained with the level of detail that you deserve as an informed patient. Subscribe right now, activate the bell. It is completely free and it could change your treatment starting today. There are men in Spain, the United States, Mexico, and Argentina who have been following this channel for months and who write to me telling me that for the first time in years, they understand what is happening in their bodies. That's exactly what we want for you too today. Subscribe. Don Sotero, 67, had been taking Tamsulosin for 14 months when he came into my office with a question that gave me pause. He told me, "Doctor, I know that the medication works for me. I urinate better, I sleep better, I wake up less at night, I don't have any results. But I've been taking this capsule every day for 14 months at dawn, and no one has ever explained to me exactly what it does inside my body. They tell me that it relaxes the prostate and that's it. But something that I take every day for a month must do more than that alone. What really happens to my body every time I take it?" That seemingly simple question is the one that no patient asks and that no doctor answers solely because there's no time for it in an 8-minute consultation. And yet, no, it's exactly the right question. Because the man who understands what his medication really does in his body is the man who can identify when something is not happening as it should, the one who can optimize the conditions in which he takes it, the one who can anticipate the effects instead of being surprised by them. I told Don Sotero, "You're right, we're going to answer that question in detail." And that's exactly what we're going to do today. The story begins 30 minutes before Tamsulosin reaches the intestine and begins with something that most men don't consider part of the medication's ancillary effect, what's in the stomach at the time of ingestion. Extended release Tamsulosin is contained in a capsule with a special coating designed to resist stomach acid and dissolve in the small intestine at a higher pH diet. That means the capsule passes through the stomach largely intact and begins releasing its active ingredient in the duodenum and proximal junction. But how quickly that capsule travels through the stomach and into the small intestine depends directly on what's in the stomach at the time. An empty stomach has different motility than a full stomach. On an empty stomach, the interdigestive motor pattern, the so-called migrating motor complex, produces periodic contractions that sweep the stomach contents through the intestine at a faster rate. Where a Tamsulosin capsule taken on an empty stomach reaches the small intestine more quickly than the same capsule taken after a meal. And the shorter transit time through the stomach means the capsule reaches its site of absorption in better condition for rapid dissolution and more intense absorption. In pharmacokinetic studies, the bioavailability of Tamsulosin taken on an empty stomach is 20 to 30% greater than the same dose taken after a moderate mixed meal, 20 to 30%. The world tooth in. That's not a small difference. That means that the man who takes his Tamsulosin on an empty stomach is effectively receiving 1 to 1/3 more active medication than the man who takes it after breakfast with the same capsule, the same dose, and the same prescription. Don Sotero took his Tamsulosin on an empty stomach every morning upon waking, mezzotrin before any food. He did it because it was the easiest thing to remember. The capsule on his nightstand, the glass of water prepared the night before, the first thing he did when he opened his eyes. 14 months of increased absorption, 14 months of higher peak concentrations and desired mass of more intensive months of more intense effects than his doctor had gauged when he prescribed the standard dose. As I explained it to him, Don Sotero asked me something that reveals exactly how much the average patient understands their own medication. So have I been taking more medication than I was prescribed 14 months without knowing it, modafinil? Essentially, yes. Not more in terms of the milligrams in the capsule, more in terms of how much of that milligram actually gets into the system. And that difference has consequences that are felt in the body, even if the man doesn't know how to attribute them to the medication. Once Tamsulosin crosses the intestinal barrier and enters the bloodstream and bladder alley, where bliski. Second phase begins. And this phase reveals something about the medication that the package insert mentions in technical terms that very few patients understand in actual physiological terms. Tamsulosin in the blood does not circulate really. It circulates bound to plasma proteins, make lip alpha-1 minus acid glycoprotein in a proportion of 94 to 99%, and that means that at any given time, only between 1 and 6% of circulating Tamsulosin is in free form and available to bind to alpha-1 receptors in the tissue. So why does it matter? Because the concentration of alpha-1 acid glycoprotein in the blood is not fixed. It changes with the inflammatory state of the body. It increases during infections, surgery, severe stress, and active inflammation. And when it increases, it binds to more Tamsulosin, reducing the available free fraction and reducing the pharmacological effect of the medication. A man who takes Tamsulosin and develops a respiratory infection, active joint inflammation, or any significant inflammatory process may notice that his prostate symptoms worsen during that period. Not because the prostate has changed, but because the systemic inflammation is increasing the protein that captures the medication and reducing the active fraction that reaches the prostate receptors. Don Casildo, 69 years old, came to me with that exact pattern. Excellent prostate control for most of the year and episodes of worsening symptoms that always coincided with cold colds, bronchitis, or flare-ups of his osteoarthritis. His rheumatologist and his primary care physician had never connected the two. I asked about the temporal coincidence because I know that inflammation alters the protein binding of Tamsulosin. The pattern was so clear in his medical history that it left no doubt about the mechanism. The third phase is the one that has the most visible impact on the body and the one that explains most of the symptoms that men on Tamsulosin experience without being able to connect them to the medication. This is the receptor binding phase. When free Tamsulosin reaches the tissues, it seeks out alpha-1 receptors to bind to. And here is the point that completely changes a man's understanding of his medication. Those receptors are not just in the prostate. They are in the prostate, Yes, specifically the alpha-1 receptor subtype, which is the predominant one in prostate tissue and the one that Tamsulosin has the highest relative affinity for blocking. But they are also in the arteries and arterioles throughout the body, in the capacitance veins that store blood volume, in the smooth muscle of the upper urinary tract, in the iris of the eye, in the seminal vas deferens in the forens. And as we discussed in the previous video in this series, in the central nervous system, where they have functions in the regulation of wakefulness, attention, and the sleep architecture. When Tamsulosin reaches its therapeutic concentration, all of these receptors in all of these tissues are being blocked simultaneously, not just the prostate receptors, all of them. In the prostate, soothe muscle relaxation, reduced urethral exege, improved urinary flow. That's the desired effect in the peripheral arteries. Vasodilation, reduced vascular resistance, decreased blood pressure. That's the cardiovascular aviculate that produces orthostatic hypotension. In the capacitance veins, dilation, reduced venous return to the heart, reduced cardiac output in the upright position. But that's the mechanism that amplifies hypotension upon standing. In the iris, relaxation of the pupillary dilator muscle, which can produce a floppy iris syndrome during cataract surgery that we dizzy ko ketrak oho, nella puede darlo of the series oxumero. In the central nervous system, blockade of alpha cerebral receptors that regulate the sleep-wake cycle and the architecture of deep sleep. All of this occurs simultaneously every time you take the capsule every day, as long as the concentration of the medication remains the same within the therapeutic range during the hours of action. I'm Dr. Isabel Martinez. If you've been taking Tamsulosin for months or years and you're just now discovering that this medication does a lot more to your body than you were told when you were prescribed it, that's exactly the reality that this channel exists to show you. Subscribe right now, hit the bell icon, and share this video with that guy you know who takes Tamsulosin and thinks it's just a prostate pill, because it's so much more than that. And he deserves to know. Z deserves to know. Subscribe. The fourth phase, which occurs between 4 and 6 hours after taking it, is the peak concentration phase. And it's the phase that's most important to understand, because it's when all the effects we've just described are most intense. In extended release insulin, the blood-glucose curve has a characteristic shape. It gradually increases after intestinal absorption reaches a maximum peak between 4 and 6 hours, and then decreases just as gradually over the next dose hours until the next dose starts the cycle again. That's it. Peak is the time of greatest prostatic effect. The prostate is in its most relaxed state. Urinary flow is optimal. Bladder emptying is most complete, but it is also the temban of greatest cardiovascular effect. Blood pressure is at its lowest point in the 24-hour cycle. The vessels are in their greatest state of dilation. And the autonomic nervous system, if the pressure drop is sufficient to activate the VAR receptors, is in its state of greatest alkopy. The exact time of the peak depends on when the medication was taken. Taken at 8 a.m. After breakfast, the peak occurs between noon and 2 p.m. when the man is active, upright, hydrated, and the autonomic nervous system handles any compensatory response efficiently. Taken at 10 p.m., the peak occurs and 4 a.m. during the deepest sleep. The dominant parasympathetic tone of sleep makes the compensatory response more intense, more abrupt, and capable of waking the man from sleep with the symptoms that we describe this in detail in video 7 of this series. The timing of the dosing is not an administrative detail. It is a pharmacological decision that determines at what time of day the body has to handle the maximum peak of the medication, and whether that handling occurs under favorable or unfavorable conditions. Don Sotero took his Tamsulosin on an empty stomach at 7 in the morning. Its peak occurred approximately at 1 p.m. with the increased bioavailability of fasting dosing that we calculated earlier. That peak at 12 or 1 p.m. with a 25% increased bioavailability was the equivalent of taking a significantly higher dose than Parisian prescribed during the middle of the day. I asked him if he had any dizziness or fit afternoon and he told me, "Doctor, every day between 1 and 3, I feel kind of out of sorts." I thought it was from digesting lunch. I never connected it with the prostate medication I took 6 hours earlier. It was precisely the peak of Tamsulosin increased bioavailability, producing maximum vasodilation in the central hours of the day. The fifth phase of the Tamsulosin cycle is the one that is least discussed and the one that, however, has important implications for the management of long-term treatment. The decline phase and the period of minimum concentration. As the concentration of Tamsulosin in the blood decreases from the peak to the minimum levels preceding the next dose, the effect on the alpha-1 receptors is progressively reduced. The prostate gradually recovers some of its tone. Urinary flow may be slightly less abnormal in the hours prior to the next dose than during the peak hours. In most men, this variation is small and does not produce noticeable symptoms. However, in men with significant prostatic hyperplasia and high residual urine volume, this reduction in the effect during the period of minimum concentration may be sufficient to produce much more frequent non-nocturnal symptoms precisely in the hours prior to the next dose, which, if the drug is taken in the morning, is the early morning hours. Don Rodrigo, 72 years old, took his Tamsulosin at 9 in the morning and consulted me because his nighttime symptoms were consistently worse between 4 and 6 in the morning. Those 4 or 5 in the morning were exactly the hours of minimum concentration of his medication, 19 to 20 hours after the morning dose. The prostate was in its least mycologically relaxed state. Bladder emptying was most compromised. The symptoms that he had forgotten about during the day, reappearing hours of least coverage of the medication. The adjustment was to change the dose to 2 in the afternoon after lunch. The peak was moved to 8 or 9 at night. The period of minimum concentration was moved to 10 or 12 in the morning of the following day, when he was active and awake and the symptoms were manageable. The nights improved markedly without changing the dose or medication. Time. Always the time. The sixth phase of the cycle that occurs every time you take Tamsulosin involves something that no doctor ever mentions in a urology consultation, yet it is clinically relevant to men who are also taking medications for other conditions. That phase is hepatic metabolism and its interactions ends. Tamsulosin is primarily metabolized in the liver via the cytochrome P450 enzyme system, specifically the CC3A4 and CP2D6 iso enzymes. The same isoenzymes metabolize dozens of other medications commonly used by men aged 65 and older. When a medication that is metabolized by the same pathway is taken with Tamsulosin, one of 2 things can happen. If that medication inhibits the C3A4 or CP26 enzyme, Tamsulosin is metabolized more slowly. Its blood levels are increased at a dim rate, and its effects are more intense and prolonged. If that medication induces these enzymes, Tamsulosin is metabolized more quickly, its levels are lower, and its effectiveness may be reduced. Medications that most frequently inhibit CP34 and are regularly taken by older men include some antifungals such as Flonoces, which used for harnesses de los lesions, some macrolide antibiotics such as clarithromycin or azithromycin, which are commonly prescribed for respiratory infections, some cholesterol medications in the statin family, although the effect varies depending on the specific molecule, and grapefruit juice, which has a well-documented CP34 inhibitory effect that very few patients are aware of. Don Evaristo, 73 years old, presented to the emergency department with severe hypotension of 82 days over 54 after starting a course of clarithromycin for bronchitis. He had been taking Tamsulosin for 2 years without any significant episodes of hypotension, or clarithromycin had inhibited the hepatic metabolism of Tamsulosin, raising his blood concentrations to levels that his cardiovascular system could not handle without severe symptoms. The emergency physician identified the interaction. Clarithromycin was replaced by an antibiotic that did not inhibit CPD4. Within 48 hours, Don Aristo's blood pressure had completely normalized. How many times had Don Evaristo been asked in 2 years of urological follow-up if he was taking any new antibiotics? 0 times. Because in the urology consultation, they ask about urological medications, not about the antibiotic that the GP prescribed last week for bronchitis. The 7th dimension of what happens in your body every time you take Tamsulosin is the one that most psoriasis patients, when I explain it in consultations, it is the one that produces that expression of genuine discovery that validates all the work of this channel. Every time you take Tamsulosin, your autonomic nervous system is recalibrating its response to the medication. Not consciously, not in a way that you can feel directly, but in a real and measurable way over the months and years of treatment. The alpha-1 receptors that Tamsulosin blocks are not static structures. They are dynamic proteins that the body synthesizes, degrades, and modifies in response to the pharmacological conditions it experiences. When a receptor is chronically blocked, the body can respond in two opposing ways, DAFA, depending on the duration and intensity of the blockade. In chronic low-intensity blockade, the body can increase the number of available receptors, a process called upregulation, as an adaptive response to maintain normal signaling despite the blockade in nowadays. Over time, this can produce a certain tolerance to the effect of the drug, where the same dose produces a lesser effect than at the beginning because there are more receptors available to be blocked than the drug can cover. In blockade of greater intensity or longer duration, the opposite process can occur. The receptors become hypersensitive to the agonist signal, so that when the drug is withdrawn or its concentration falls, the response to endogenous norepinephrine is disproportionately intense. That's the rebound mechanism that we described in the 5th video of this series when we explained what happens to the body in the first 24 hours without Tamsulosin chami. Don Sotero asked me when we got to this point in the explanation, so is my body adapting to the medication every time I take it? And does that adaptation change how it's going to affect me in the future? Exactly. The Tamsulosin that you take today does not produce exactly the same effect as the Tamsulosin that you took the first month of treatment. Your body has learned to live with it in ways that affect both its effectiveness and side effects in a way that no standard annual checkup measures nowise. I'm Dr. Isabel Martinez. We're in the final stretch of this video, and I want what comes next to be what you take away for you in a practical and immediately applicable way. Subscribe if you haven't already. Hit the bell because the videos that follow in this series build on what we've discussed today in ways that only make sense if you have this foundation. Subscribe. The practical protocol that results from understanding everything that happens in your body every time you take Tamsulosin has 6 points that you can implement from tomorrow. The first point is food. Always after a mixed meal with protein, fat, and complex carbohydrates. Never without eating. Never with only coffee. The difference in bioavailability between taking it on an empty stomach and taking it after a proper meal can be equivalent to changing the dose by 25%, and no doctor is going to intentionally prescribe you 25% more medication than you need. The second point is the time after breakfast, which places the maximum peak concentration in the central hours of the day when the autonomic nervous system can manage the cardiovascular response efficiently and the man is in the best condition to tolerate the vasodilator effect of the medication. The third point is hydration. Arrive at the time of maximum peak well hydrated, with an adequate circulating volume to cushion the drop in pressure. What is eaten and drunk in the hours prior to the peak is as important as what was taken with the medication. The fourth point is reviewing all new medications before starting them. Any antibiotic, antifungal, heart medication, or supplement that is added to the regimen can interact with the hepatic metabolism of Tamsulosin, so no physician will evaluate it unless the patient asks directly. The fifth point is environmental temperature as an active pharmacological variable. Days of intense heat, saunas, very hot baths, excessively heated environments all amplify the vasodilatory effect of the medication in a way that the body has to compensate for. On days of extreme heat, the awareness that the medication is working more intensely than on warm days can make the difference between getting up cautiously or getting up quickly and ending up on the floor. And the sixth point is documenting changes over time. A man who keeps a simple log of his symptoms, of how he feels after noon, of the quality of his sleep, and of the days when he notices differences, can detect the adaptations his body is developing to the medication before those adaptations produce significant synapses, and can take that information to his doctor instead of relying on memory to describe how he has felt for the past 6 months. Don Sotero left that first consultation with a look on his face that I know well. Not the look on the face of a patient who has received bad news, the look on the face of a man who, after 14 months, finally understands what is inside him. He said to me, "Doctor, 14 months of taking this capsule every day without knowing anything about what you just told me, and now that I do, I feel like I am finally the one in charge of my treatment instead of the treatment managing me. That is exactly what it means to be an informed patient, not someone who receives a prescription and follows it without question for months or years. Someone who understands the mechanism of their treatment in enough depth to make active decisions about how to optimize it, how to protect themselves from its side effects, and when the situation requires having a different conversation with their doctor. That level of understanding is what this channel provides every week, and is what every man taking Tamsulosin in Spain, the United States, Mexico, and Argentina deserves to have from the first day of their treatment. I'm Dr. Isabel Martinez. Before I close, 3 quick things. First, subscribe to the channel right now if you haven't already. It's free and worth every second. Second, leave a comment below to find out which of the 7 things that happen in your body every time you take Tamsulosin surprise you the most. Your answer will help the entire community of men reading us from Spain, the United States, Mexico, and Argentina know what information is coming in and what information is still missing. And third, share this video with that man who takes Tamsulosin and thinks it's just a prostate pill, because after watching this video, he'll know it's much more than that, and that changes everything. See you next time.